Hi, my name is Joanne. I'm a third-year pharmacy student at UNC, and I'm going to be presenting on environmental injustices and access to healthcare. So for some background, North Carolina has a continued presence of CAFOs and coal ash impoundments, and these have been associated with poor health outcomes and healthcare issues such as kidney disease and infant mortality. These environmental exposures are also disproportionately located in communities with people of color, immigrants, and lower socioeconomic status. This study is going to look at communities with environmental injustices and assess access to healthcare and medical resources. So for our methods, data was collected from publicly available data sets, such as the ACS and CDC Wonder. We developed 4 study groups. These were stratified based on their exposure to either hog CAFOs, poultry farms, coal ash impoundments, or a combination of 2 or more of those exposures. We also developed a control group that consisted of 23 predominantly rural North Carolina counties without those environmental exposures. So we collected data on demographics and socioeconomic characteristics, environmental exposures, health outcomes, and healthcare professionals, and healthcare access. So we calculated averages for each study group and calculated confidence intervals to assess statistical significance. And through this analysis, we found that the coal ash impoundment group actually had higher rates of healthcare professionals per 100,000 than the other study groups. So we decided to perform a sensitivity analysis that would account for the higher levels of urbanization in some of the counties in the coal ash impoundment group. So these were Forsyth, Mecklenburg, and New Hanover counties. So in our results, we can see in figure 1, starting with counties with hog farms, these had the highest percent of Black or African Americans, highest percent of American Indians and Alaska Natives, and Hispanic or Latino populations. Counties with coal ash impoundments had the highest percent of foreign-born residents, and counties with hog farms also had the lowest with a bachelor's degree, but the highest with less than a high school degree. Counties with hog farms also had the highest percent that lived below 100% of the poverty threshold, and they had the highest living without internet access. Moving to figure 2, we can see environmental exposures presented by particulate matter and volatile organic compounds. So you can see that counties, or the control group actually had lower emissions than the study groups. And then looking here in particular, counties with 2 or more exposures had the highest emissions of particulate matter, and counties with coal ash impoundments had the highest emissions of VOCs. Looking at table 1 at mortality rates and preventable hospital stays, these cells here in pink, these were statistically significant, and cells that are in yellow had some difference with the control, but were not statistically significant. So counties with hog farms had the highest rates of mortality and the highest rates of death due to cardiovascular disease, kidney disease, and neoplasms. Counties with hog farms also had the highest rate of preventable hospital stays. Counties with coal ash impoundments in the sensitivity analysis, they showed that they have the highest rate of death due to respiratory disease. And we can really see the difference here that the sensitivity analysis did. So when we don't account for urbanization, counties with coal ash impoundments, it seems that they actually have the lowest rate of death due to respiratory disease. However, when we do account for urbanization and we took out Mecklenburg, Forsyth, and New Hanover counties, counties with coal ash impoundments then have the highest rate of death due to respiratory disease. Moving to table 2, we can look at healthcare access measured by healthcare professionals per 100,000. We can see that there's actually no difference in the rate of pharmacies in the study groups compared to the control. However, counties with poultry farms have the lowest rate of pharmacists per 100,000 compared to the other study groups and the control. And then across the board at all the other healthcare professionals and specialists, counties with hog farms have the lowest rate of healthcare professionals compared to the other study groups and the control. And we can also see that the control actually in some cases has double, triple, or more or higher the rate of healthcare professionals than the counties with hog farms. So counties with hog farms, for example, if we look at general internal medicine specialists, the rate is 10.66, but looking at the control, it's 44.64. And then looking at other areas, more specialized areas like pulmonary disease specialists, counties with hog farms have a rate of 1.42, but the control has 8.08. So overall, our research shows that counties with environmental exposures, environmental injustices, especially those in hog farms, have a severe lack of healthcare access and healthcare professionals. It is critical to improve healthcare access in these populations living with environmental injustices. And the results from this study hopefully will inform future research of factors that can contribute to worse health outcomes in communities with environmental injustices. Thank you so much for listening.